Welcome to my YouTube channel. Thanks very much for the subscriptions, for those ones who subscribed. Those ones who have not yet subscribed, please do one thing: subscribe. We continue to learn, we continue to drive diseases outside of our life. Today we are going to look at the common cause of infertility in women. The common cause of ectopic pregnancies in women. The common cause of sterility in women. And the common cause of discomfort. And many ladies are suffering from this condition. When you look at the percentage, we have 50% of the ladies suffer from condition commonly known as pelvic inflammatory disease. Many of you have been hearing this condition, PID, pelvic inflammatory disease, but not knowing really what PID is and what does it mean, what does it imply, what are the complications, how do I know that I'm having pelvic inflammatory disease, what is it? Is it like malaria? Is it like what? What causes it? What brings it? How do I diagnose it? How do I treat it? So, a pelvic inflammatory disease is a disease of the upper genitalia, polymicrobial infection caused by upward migrating infectious pathogens. What do I mean by polymicrobial? It means that it doesn't have a single agent, a single pathogen that causes it. So it is caused by a number of pathogens that have ability to migrate from where to where. So when you get your infection here, this is your vagina. So when you get your infection here, when these pathogens have ability to migrate from the vagina through the cervix to the uterus to the fallopian tube to the ovaries. Worst case scenario where these pathogens can jump. They can jump from the uterus, they cross, they enter the peritoneum. So this is the peritoneum. The peritoneum is the cavity that encloses abdominal organs. We have the stomach, the liver, the pancreas, the large intestine, the small intestine, the jejunum, the duodenum, all of those in the stomach. So they lie within a cavity called the peritoneal cavity. So when these pathogens they can in some cases have ability to cross to the peritoneum and cause what we call peritonitis. Those ones which move to the fallopian tube and colonize there, those pathogens that are going to colonize the fallopian tube, they are going to cause inflammation of this tube. They cause inflammation of this tube, which we refer to as salpingitis. That is inflammation of the fallopian tubes. Then we are going to have those pathogens that are going to cross and they go to the ovaries and cause inflammation of the ovaries. Inflammation of the ovaries, we refer it to as arthritis. Then we are going to have those ones which are going to cause the abscess between the fallopian tube and the ovary, which we call the tubo-ovarian abscess. We are having salpingitis, which is a bacterial infection. We are having, and the salpingitis is inflammation of the fallopian tube. We are having arthritis, which is inflammation of the ovaries. And this one leads to sterility, can lead to infertility, and the increase the ectopic pregnancy chances. Then we are having tubo-ovarian abscess, which is a complex infectious mass of the adnexia. So that is the tubo-ovarian abscess. What are the common causes of pelvic inflammatory disease? We said it is a polymicrobial infection of the upper genital. So what are the common causes of pelvic inflammatory disease? We have chlamydia, trachomatis, we have Neisseria gonorrhea, we have aerobes and anaerobes that cause urinary tract infections and the sexually transmitted infections such as bacterial vaginosis, and they have ability to move upwards, to migrate and cross the cervix, enter the uterus, they go to fallopian tubes and furthermore to the ovaries. So once you have a sexually transmitted infection, you have a urinary tract infection, and the causative agents, they have ability to move upwards to those areas. They are going to cause what we call pelvic inflammatory disease. What are the signs and symptoms of PID or pelvic inflammatory? The common signs and symptoms of PID, we have lower abdominal pain. Just here, in the umbilicus, we have lower back pain, we have vaginal discharge, we have itching in the private parts, we have unpleasant odor that will come from the private parts, we have fever, we have vomiting, and so many other signs and symptoms. Painful sex, painful menstruation or urination, so painful menstrual periods. So those could be possible signs of pelvic inflammatory disease. How do we diagnose ophthalitis? How do we diagnose salpingitis? How do we diagnose peritonitis? How do we diagnose tubo-ovarian abscess? We are going to be seeing each one of them individually in details in the subsequent videos. Stay tuned. Thanks for watching.